So this is a phase 2 investigator-initiated study where we looked at induction for newly diagnosed Ph-positive ALL utilizing a Dasatinib plus inotuzumab-based regimen. Initially, our induction period consisted of 2 cycles of Dasatinib plus inotuzumab. So we enrolled 7 patients on that part. And our primary endpoint was achieving a major molecular remission or deeper. And that was after 2 cycles of therapy, which is when we assessed that. What we found was for the first 7 patients enrolled, all 7 met that primary endpoint. However, we did see a signal of veno-occlusive disease, or VOD. So 2 of our first 7 patients developed veno-occlusive disease. The reported rate of VOD with inotuzumab historically has been around 10% or so. So with that in mind, we paused the study, we amended the protocol, and we ultimately split the dosing of Dasatinib and Ino. So for the subsequent patients that have been enrolled, 12 up until this point, we gave Dasatinib plus steroids for cycle 1 of therapy and inotuzumab monotherapy for cycle 2. Our primary endpoint remained the same, which is MMR or better at the end of 2 cycles, and that has been achieved in 9 of 12 patients so far. This is also an adaptive study, meaning for patients who did not achieve a complete molecular remission, for cycle 3 and onwards, they were transitioned to Ponatinib, a 3rd-generation TKI, and every patient treated on study so far has achieved MRD negativity either by NGS to a sensitivity of 10 to the negative 6th, or a CMR based on BCR-ABL PCR at the end of cycle 3. So we found this to be a very promising regimen. It seems like you don't need to give a whole lot of antibody-based therapy to achieve a deep remission. And I think the adaptive nature of our protocol allows for switching someone's TKI if you're finding an inadequate response and being able to deepen that response and get the CMRs that we're looking for that we know translate with long-term survival. The initial toxicity signal of VOD has not been seen at all since we've separated the 2 agents. So of all 12 patients that have been treated with this updated dosing regimen, we have not seen any evidence of VOD.